Good evening and welcome to another episode of IMED. And urinary diseases are common among certain adults. And when it comes to difficulty in urination, we are going to talk about this particular condition which is prevailing in most of the adults as well as the prostate disease today. So to discuss these topics, we do have with us today Professor Neville D. Pereira, Senior Consultant of Urological Surgery at the Institute of Urology, National Hospital of Sri Lanka. Good evening to you, Professor.
Good evening.
So, difficulty in passing urine, or we call it retention of urine, some have it in other presentations as well. So, why this condition takes place in adults, doctor? Why is it common?
Yes, that's a problem among the adults and the males and females alike, and then even in children you find it find problems in passing urine. And out of that, retention is the far end of the spectrum where you stop passing urine at all, and on the other hand you can have various symptoms before that, like delay in starting the stream. You go there to the toilet and wait for a while and nothing comes out, and or else sometimes you can have intermittent stream. You pass urine in portions, so you have to strain to pass urine. Sometimes this urine stream with age it goes down, so sometimes you can't aim it properly to the toilet or commode. So this type of symptoms shows that your bladder, which is the organ which collects urine and empty, bladder has got blocked, and this bladder blockage can be due to various reasons, and out of those in adult male the commonest cause is the prostate. If I can mention few words about the prostate. Prostate is something like a little areca nut. You can see this little like a little lime, if I say more familiar words. It is just below this bladder. You can see the urinary bladder here, and just below the bladder you get this lump there. It is something like a little lime, as I was mentioning, because many people don't have any idea about the prostate. They keep on telling that I have prostate problem, my prostate is enlarged, my prostate is cancerous. If I just simply ask, what does it look like? Now, if you say it's a nose, you know what it is. A lot of people don't have any idea about it. It's a lump here, and water pipe from the bladder goes through this lump and come to the exterior. So what happens is, when this gland with age get enlarged like this, the second picture shows, now here it is a normal one, and the other one, the gland, the central part of the gland get enlarged with age, it blocks the water pipe, and that is the starting point of all these symptoms. And at one stage this water pipe get completely blocked, and then you go into the situation called urine retention, acute urine retention. So occasionally, not quite often, this enlargement may not be only age related, it can be a cancerous growth. So that is the danger which all the men have, and then we have to exclude.
So that means there are enlargements which are cancerous and which are not cancerous, as in like we call BPH, the benign prostatic hyperplasia.
Correct.
So how to differ these two conditions, doctor, whether this enlargement is cancerous and this is not cancerous?
Yeah, that is kind of a difficult problem, because all the symptoms are more or less same. What happens is actually, whether it's a cancer or a benign prostatic enlargement, in both occasions the water pipe get blocked and you get these symptoms which I mentioned. But occasionally, if a person had these symptoms for a long period, say maybe about a year or two, and suddenly during the last few months or few weeks, there is sudden deterioration of these symptoms, suddenly the symptoms take a bad turn, then of course we have to suspect that it may be getting converted into a cancer. Cancer can coexist, both diseases can coexist. So other than that, it's pretty difficult to say whether it is cancer or benign prostate at early stages. Once the cancer is well advanced, well established and advanced, you get certain symptoms which are late symptoms, like when the cancer spreads. We'll be discussing it in a minute. spreads, then you can get backache and then numbness in lower limbs with these urine symptoms, sometimes pain between the legs, because the cancer is eating into your nerves. So we will be discussing it in a minute.
Yes, we can now discuss about the cancerous aspect of the prostatic disease.
Yes, if you get a cancer, the first thing is we have to find out whether it is a cancer or not. So you will have to undergo certain investigations once you develop these symptoms, like difficulty in passing urine. If you are in the age of 40 to 70, like older you are, there is a higher chance of getting a cancer. Not everybody. So you have to get investigated first. So moment you have these symptoms, best thing is not to ignore, because lot of people what they do is they think that this is age related. They say that all the old people will have this, and they tend to ignore it. But especially if you get these symptoms in the age of, at the age of 40 to say 55, 60, early late adulthood, you have to be concerned about cancerous problems. So you have to present to your general practitioner or a specialist clinician. So initially when you do that, what will happen is, now this slide will show the cancer symptoms, and then when you present that, we will be starting with some basic investigations like urine full report, blood ureas and creatinines, and the most important investigation will be after checking the prostate through the rectal examination. Prostate can be felt through the rectum because it is very close to it. Sometimes even before doing the rectal examination, we do the test called PSA, prostate specific antigen, which is a blessing actually when it comes to prostate cancer. When you do this PSA, if it is above, it comes as a figure. So if it is above and unusually elevated above the normal levels, then you have to suspect a cancer. But mind you that all the increased PSAs are not cancerous prostates. So sometimes chronic infection can lead to increased PSA levels. So the PSA is prostate, it's specific to prostate, but it is not specific to the disease. So if you get a high PSA, you need to be investigated, but you should not label yourself as having a prostate cancer. So once now these are the basic tests we will be doing, showing it here. Initially we need ultrasound scan, which will give a lot of information about the prostate size, whether it is blocking the bladder, whether it is allowing the bladder to empty, and though it can't predict a cancer. Ultrasound can't predict a cancer by just looking at it, but it will give other information regarding the prostate enlargement and the complications which it has caused, like bladder blocks, kidney blocks. Those things you can find out. And always the ultrasound will be combined with another investigation called uroflowmetry or urine speed test. You just pass urine into a special machine which is shown in this slide, and then you will know whether your bladder is blocked or not. Because some people, bladder is a poor witness. Some people will come and say that I can't pass urine, my stream is slow. But actually speaking, when you test it, he is passing urine well, and vice versa. Because of that, this uroflowmetry or urine flow rate study is quite useful. Once we have done these things and you are suspecting a cancer, strongly suspecting a cancer, next step is to take a small piece from the prostate gland.
Biopsy.
So biopsy, that is called a prostatic biopsy. Nowadays the current method of doing that is putting a small probe, a part of the ultrasound scanner, into the rectum under local anesthesia. Local anesthesia is a day case, in and out, and then by visualizing the prostate gland, the radiologist can send a tiny needle along that probe and then take about say 10 to 15 pieces from the prostate gland, and that will give us the definitive diagnosis, and that is called transrectal, going through the rectum, transrectal ultrasound guided prostatic biopsy or truss biopsy in short.
Right. After these investigations, now Professor, if this patient is diagnosed is with a cancer, or if it's a non-cancerous enlargement, what are the separate treatments that we can discuss about?
Yeah. When it comes to treatment, I think once we have suspected and diagnosed benign prostatic hyperplasia, nowadays many people can be managed with various lifestyle adjustments and drug therapy. Like good old days, we don't have to operate on them. I mean, 10-15 years back, I think we were operating on all the people who said that they can't pass urine. So daily we had about 7 or 8 prostate operations. Now even to find 2 operations a day is a rarity. So what happens is, if once the investigations are done and if we feel that the prostate is not causing much trouble but only the symptoms, what we can do is advise him to change his lifestyle, because there are some people who will drink a lot of water during daytime, say about 3-4 liters a daytime, thinking that water is good for their body. That is true, but then it's not that good for this particular disease, because if you keep on drinking a lot of water, the prostate which is blocking, the bladder which has got blocked by the prostate can't empty. So you have to go to the toilet about 15 times a day. So if you tell them that just drink when you are thirsty, or just drink about say 2 liters a day, suddenly you find that his frequency of passing urine goes down. And some people come after work and then start drinking water after 5 o'clock. And all this water get filtered in the night, and they keep on getting up in the night. And they think this is the prostate. True that their prostate is enlarged, but only little advice you have to give is that stop drinking after 5 o'clock, because the body doesn't need water after 5 o'clock. Only a little bit of water is needed. So the moment they stop drinking after 5 o'clock, they are getting up in the night, which is called nocturia, goes off. So this type of little lifestyle adjustments, plus there are some drugs, tablets nowadays, which to relax the prostate and shrink the prostate. One group is called prostate relaxants, the other group is called prostate shrinkers. Prostate relaxants, when you give them, the prostate prostate has some muscles, it gets relaxed, and then you find it easy to pass urine. And prostate shrinkers will take about 2 years to do the job, 2 to 5 years. Those are long-term medication. If you take them properly, that will shrink the size of the prostate to a smaller size. So if you take the combination, get the combination, most of the prostates can be managed on these 2 drugs. So nowadays about 80% of prostate people will get tablets.
So what will need surgery? At what stage this prostate disease might need surgery level?
Yes. Indications for surgery are now quite lesser than what it was. Main reason is drug failures. That means you keep on taking drugs and the patient comes and tell you, no, it's no good, these drugs are no good because my symptoms are still the same and I still get up in the night, my stream is poor, so drugs are not working. So after trying the drugs for about 3 to 6 months, if the drugs are not working, and when you repeat the scan and you suddenly find that bladder is still not emptying or the prostate is growing in spite of giving drugs, then you decide, the specialist has to decide that it is a drug failure or drug treatment failure, and then move him towards the surgery. And on the other hand, while on drugs, if we get complications, what happens is sometimes while on drugs, he keeps on getting infections because the bladder is not emptying properly, and he gets stones. Or sometimes when you do the next ultrasound, check-up ultrasound, you find that the kidney is getting bloated up, kidneys are blocked. Then you know that the drugs have failed. And even at the first ultrasound, if the kidneys are blocked, there is no place for drug treatment. If the ultrasound says the kidneys are bloated up, blocked, no place for drugs, you straight away go for surgery. So drug failure is the common one. And then we offer surgery for these patients.
Right. So is there a reoccurrence after this treatment, Professor? Can a patient get it again?
Yes, actually once we have done the surgery, which I have depicted in this slide, the types of surgeries we do nowadays 90% of surgeries are done without a cut. You can see this After failing these tablets, you can put a little telescope into the bladder, and then you see this prostate gland like two little lumps jutting into your water pipe, and then you can use electrocautery here, electrical device to cut the gland into small pieces and wash it off, and takes about 45 minutes to 1 hour, and then you clear the passage completely for the patient to pass urine. So you can either use these electrical devices, which is commonly done, or you can use even laser. So both, laser is just an instrument, you can use laser. So that will avoid these big cuts to remove the prostate. And if you remove the prostate, if you do the surgery, only 5% of patients will have it regrown after about 5 years. So it's a very rare thing. But drugs, of course, if you take the drugs, most of them are okay, but about 20% of them will fail on drugs, and they will have to undergo surgery.
So even if it's a prostate cancer, then after the surgery, these patients need to undergo chemotherapy or radiotherapy or any other cancer treatments?
Now, when it comes to prostate cancer, the treatment is slightly different, because prostate cancer, as we all know, it comes from the peripheral area of the prostate gland. So by putting a telescope and taking the central part out, coring it out from the center will not cure it. So if you want to cure that cancer in a younger patient, what you have to do is to remove the whole prostate altogether, and you will see that in this picture, prostate is here, and then the surgery done for the prostate cancer includes removing this whole gland with its shell completely out, and then join this water pipe to the bladder. It's a major surgery, very specialized surgery, which is called radical prostatectomy. That is generally offered to younger people who have a lifespan over 15 years or so. Older you are, we move away from the major surgeries, and we offer the second option, which is given here, that is radiotherapy. Radiotherapy to destroy the cancer cells, and then if the cancer has spread, then you have to block the male hormones, because the cancer thrives and lives on male hormones, which is called testosterone. There are various drugs to block those hormones and relieve your symptoms.
Now, Professor, one can question that does this male need the prostate afterwards? Once it is taken off at a very young age, will the patient, especially when it comes to a male, is there a particular effect on his lifestyle after removing
Yes.
the prostate gland itself?
Yeah. Very pertinent question, because if you are diagnosed to have a cancer, then we have to have a lengthy discussion with this patient, especially if he is young and sexually active. So what we have to do is we have to tell him that there are two main complications of this cancer surgery. That is, one is erectile dysfunction or impotence, which is quite high. You know, about 70% of them will find it difficult to have normal intercourse. And other problem is, for a short period you will have incontinence, that is poor control of your passage of urine. But fortunately, more we if you get it done from a more experienced center, then the chances of incontinence is much less. But however experienced the surgeon is, the impotence rates are still pretty high. So for that there is a different treatment, different type of treatment. Injectables are there, and then prosthesis, penile prosthesis. So it's a different specialty. So that is not the end of the road. So we can tell them that always that you can get the cancer cured, and if the erection problem is a serious problem, a family problem, a social problem, then there is treatment for that later on, once you are cured of the cancer.
Doctor, now what actually can cause a prostate cancer? Can it be hereditary or inherited from the parent or the father itself, or what can be the major cause of prostate cancer?
Yes, the biggest risk factor is age. If you live long enough, if you live up to 90 years, 90% of you all will have, males will have cancer. So cancer is an age-related problem. So good news is that if you pass roughly about the age of 80 and you are found to have a cancer, generally cancer doesn't end your life. You die with it, but not from it. So because of that rule of thumb is there, after the age of 80, in many countries nowadays they don't even investigate for prostate cancer. What they say is, what's the point looking for it? Even if it is there, it's not going to give much trouble, so that we don't look for it. So older you are safer. But if you get the same problem at 50, then of course it's a problem, because after 10 years, 15 years, it can spread and give trouble. So we offer surgery or radiotherapy or some sort of a definitive treatment. But if it is at a very early stage, there's a new treatment coming up, that is observation, called active surveillance or observation. If we pick it up at a very early stage, a young person, we don't want to subject him to all these toxicity of these treatment. So we keep him under observation, and the moment we think that it is going out of control, we treat. So it might spare him about 5 years or 5-6 years of good life without any kind of treatment. Causes wise, age is the number one, and then comes the genetics. As you said, genetics and inheritance. There are prostate cancer families. All the males, most of the males in the family get prostate cancers. Those people, the idea is that you have to keep them under close surveillance, because those males, you have to, from the age of 40, we have to keep on doing PSAs and pick the cancers at an early stage, because we know that they have a strong family history.
So to sum it up, Professor will give a brief message to all our viewers regarding prostate cancers and difficulty in urination and so on.
The most important thing is, again, if you get early symptoms, there is, even if it's a cancer, cure is there, because it's a curable cancer, prostate cancer. BPH, benign prostatic hyperplasia, if you don't ignore the symptoms and wait until the bladder is blocked and the kidneys are blocked, if you present early, then there are drug treatment. Don't be afraid, don't be scared that you will be put under knife immediately, because very few people will now have operations. Even those operations are without any cuts. So present to a clinician at an early stage, and then don't ignore any of the symptoms in passing urine. Especially if you have passed blood, you have to come very early.
Thank you very much, Professor, for being with us today as well, to give you the information with regards to difficulty in passing urine, as well as the prostate disease, which is common in adults, especially males, when it comes to having prostate enlargements and the common complications. So thank you once again. We did have with us today Professor Neville De Pereira, Senior Consultant of Urological Surgery at Institute of Urology at the National Hospital of Sri Lanka. We will talk about diseases related to the urinary systems more on another episode of IMED. Thank you once again, Doctor.
Thank you.
And see you. Stay safe.